My name is Kagisoki Tsubetswe. I'm a chief registered nurse in Sbrana. I'm also a psychiatric nurse. I'm also trained in addiction counseling. I'm what you call an addiction professional. We find a lot of youth that are coming to Sbrana seeking help, and mostly will be ages ranging from 12 to 29. We have ages above that, of course, but not as much as the younger ones. So the reasons for them coming to seek help, mostly you'll find people brought by guardians or parents, those that feel their children have reached a point where they need help. But there are some who come here early volunteers, who volunteer to come and seek for help because they've been doing drugs and they feel they are affecting their lives. According to what we have noticed, is that for those who are brought, the success rate is low in recovery. And then for those who come voluntarily, being themselves, the success rate is high. The stages of addiction, the initial stage, the first stage would be experimental use. This is where somebody just tries or somebody just uses because they've seen other people using it. Most of the time it will just start like maybe, for example, somebody taking their first drink at 21st party. The second stage is that one of abuse. This one I always tell people that it's whereby you find people getting excited. These are the type of people that you find getting excited, celebrating the weekend, that is Friday. This is where now the substance now is being is used, and in a more recurring and in proper basis. And then the next stage will be tolerance. When a person uses a drug for a long period of time, the substance causes changes in the brain, how the brain functions. So at some point, the original dose that the person was using, the body would need more than the original dose. So with tolerance, you find the person increasing the dose or increasing the frequency of use. The next stage will be dependence. This is where now the body or the brain is now dependent on having the substance to be functional. You'll find that some people would not be able to do certain functions without the drug or without the substance that they were using. They would need to take it maybe every morning for them to go through the day. And then the next stage will be addiction. This is where now a person has a specific chronic mental health disorder that has defined symptoms. Now that can help us come to a diagnosis. This is where now we can say this person has alcohol use disorder or this person has cannabis use disorder. That is the next stage. And then the last stage would be a relapse. In this cycle, after treatment from addiction, you get people relapsing. It's a SUD or substance use disorder recurring after treatment. Those are the stages of drug use. Substance use disorder, as I said, is a brain disease, and treatment of addiction is not easy. It's not an easy one. The reasons for relapse vary from one individual to the other. You'd find that most of the people that we would think they are on the recovery path would relapse because of many factors. Some of them would be because of the environment that they are living in. They are discharged to the same environment. Some of them do not stick to the relapse prevention plan that we make with them. because addiction is very difficult to control. Drugs affect us differently. You find that two people would use the same drug, and another person would break down from the drug, and another person, mainly because mental health conditions do not have specific causes. There's what you call predisposing factors. Mental illness tend to run in families. It's hereditary. If you have genes of the previous generations that have had mental illness, you are likely to develop mental illnesses. So if you have mental illness in the family, and then you use substances, it can be a contributing factor because you are already predisposed. You already have a predisposition. Most of our patients, we see them as outpatients because, especially those who come voluntarily. Some of the patients would come in as, like I said before, on involuntary basis because they have a co-occurring mental illness. It's SUD and other mental illnesses. So they are already malfunctioning in the community or at home. So these are the patients that sometimes we are forced to admit and see as inpatients. And the other ones who come in without any co-occurring illnesses or co-occurring mental illnesses, we see them as outpatient. In my view, with financing of these drugs, it starts at family level, at household level. You'll find that with smaller kids, when they're given money, what you call pocket money, they would use that. If you have a child who is given a packed lunch, provided with free transport to and from school, and then they're given pocket money, they end up having this money that they don't have any use for. And with the current situation where you find drugs now in school, they end up being influenced to use this money that they were given as pocket money to buy. And when the household now decides that no, we are no longer providing this type of stipend or pocket money, then these kids will resort to stealing from the house. They'll start selling their own clothes, stealing gadgets from the house, and selling to finance this habit. To counter such challenges, I believe parents should, they should know their kids. Because one thing that I always advocate is that you need to know your children. You need to know the signs that this child is probably using. You need to observe signs like things like changes in eating patterns, being secretive of kids who usually are not secretive, the friends that they keep. And I believe with the issue that parents need to, if there's no need for you to give your child money, don't, please. Okay, generally with the community, I would like to advise them to assist in cutting the supply. Because the supply is from the community, obviously, and it's supplied by people who are known. And you find that it's very difficult for these people to be caught or reported by the community. But they know that the community, as they say, it takes a village to raise a child. So the community needs to collaborate in raising the children, because the drug use is more prevalent amongst the youth in the community. They get from the community. So the communities need to step up in collaborating and approaching and reporting cases of drug selling by drug dealers. Mascom and Tanani Walk is important in raising awareness in this, because we cannot win the fight alone. We need collaboration with the community. We need collaboration with independent companies, non-governmental organizations to assist us in fighting this. Because information, we need to take the information out there. And I believe Mascom will assist us in taking the information out there, because one, we are short-staffed, we don't have we need more time with the patients. We can't be out there giving information. So I think this type of initiatives will assist us in taking the information out there, because the youth are not, we don't interact much with them. We only see them as patients.
Many families lose their loved ones due to drugs and substance abuse. Join us for the Mascom Batanani Walk this year to take the necessary steps towards social recovery.